let's go and get started. We are recording, so we'll get this sent out to everyone. Just as a FYI, we are recording, so if you don't want your face shown, go and stop the video, because who knows, this video might go out to like 50 million people. You never know. We get some good reach here. But just FYI. So it was awesome because whenever we first posted about the Ask Me Anything, we got a ton of questions, right? So I'm over here looking at just a Google document of all types of questions. So I highlighted several that I definitely want to go over. And honestly, I love them. They're really good questions. So I want to start there, and then what we'll do is I'll leave some time at the end, and then open the floor to you guys. Or if I'm talking and you have a question, just let me know. Just chime in and ask away. So okay, so um, I love this first question, and it's a really good one, and it really gives me a good opportunity to tell my neurosolution people, especially, what are the differences between the 528 Innovations laser and the Avant LZ30Z laser, right? And so if you've been following me, if you know anything about what I've been doing, so I've been using the Avant laser. Neurosolution has been a distributor of the Avant laser for several years, and I'm not saying anything bad about it. It's a great laser. We still use it. We're using it in the office today. We use it on many patients. It's great. There are some key differences, right? So there were various things that I definitely wanted to improve upon, and that was a factor in why we started 528 Innovations, where we will be the laser manufacturer, right? Or we are the laser manufacturer. The one thing, well, there's several things. One thing that I'll point out first is the concept of modularity. So if we look at the lasers here, right? So we have the Avant here in my right hand, the 528 in my left hand. One thing that I'll definitely always point out to is this concept of the laser module. So what this allows us to do is when we come out with some fancy new wavelengths, when, let's say in 2 years, we discover that this new wavelength cures this and does this and all these amazing things, you don't have to run out and buy an entire new laser. You can simply get a new module, which will be much more cost effective than having to get an entire new laser. It also helps us to develop more robust protocols. So if we want you to use red and then 975 and then violet and then green and all this kind of stuff, you can incorporate those. And if you did see my last podcast, like what Richard was talking about with Mike, the developer of Arc LED, there's reasons to use green. There's reasons to use longer wavelengths, like 975 and stuff like that. So it'll help you to be able to incorporate these different wavelengths at a much more cost-effective way. So that's one big thing. I will say, just from a usability, from a user standpoint, obviously I've been using the Avant for a very long time. What I'll tell you from our neurosolution side, the most common thing that fails that we have seen in the Avant is the fan, right? And that just makes sense. It's a part of the laser that physically moves, and so it's going to have a higher failure rate. When the fan would go down in this product, you'd have to send it in, we'd have to get it fixed, all the things. So the solution here is that I know, I'm excited too. So the thing about this is that we can actually, well, or we actually built the fan into the battery. Okay. So number one, you have a rechargeable battery, which is awesome. Because we drain the lasers all the time in practice, and I'll drain the laser on myself at home. Just grab a new battery, pop it in, you're good to go. But if the fan does fail, you simply get another battery, you pop it in, and you're back up and running. So you're not going to have like down laser time because of that. And again, that is the most common thing to fail. Whenever we started Neurosolution and we really started to blend laser use with functional neurology and more complex disorders and this kind of thing, everyone asked the same thing. How do I use it? How do I use it? How do I use it? And so that created a lot of stress on us and our company And it was really, something where we wanted to make sure that everyone knew how to use a laser, but we had legal, things we had to navigate through if you weren't a patient and all this kind of mess. So what we're doing in 528 is we've created this amazing display. The laser will connect to your phone or iPad, and we're developing programs. So myself and Kristen Hughes, she's our occupational therapist here. We're actually writing programs about how to use the laser for XYZ reason, right? So when it releases, you'll have access to various programs so that you're not like, great, I have this amazing tool. What do I do? And we want to do this in a couple of different ways. We want to deliver what we're calling quick start programs. So when you get it, you're like, great, quick start for this, quick start for this, right? And you can just start to use a laser safe and effective ways, whether it's performance optimization, whatever it is. But then also have more targeted reasons, whether it be a pain syndrome or, whatever it is. So have programs for that. Now, can we write programs for everything under the sun? No, don't have the time. We're going to always be iterating and building that program library. So, bear with me. And what I'll say is, if you need help with something, reach out. We'll support you best we can. Okay. So we're trying to solve this problem, which I don't want to say it's a problem. It's just we want to make sure we know we can make an amazing device. Done it. We've got betas. We've got, it's amazing. Okay. Seriously, like last time we were doing an AMA call on 528, I told the story about the kiddo that had a really strong Moreau, and I've never seen a Moreau integrate so fast as when I started to use the 528 laser on him. Now, I had a meeting, I don't know, maybe a week or two after that, and these people, they were doing a project with a separate laser company. They wanted to check us out, so they came in. They were looking at the lasers, and I gave him the laser, had him put it on the solar plexus, and I look over, and this guy's crying. I'm like, what are you crying for? What did I say something? What's going on? And he's like, I don't know what's going on. Some kind of emotion just released. I have no clue. Like, so I never had that kind of response with a laser before, which was amazing. But that being said, I know we can deliver a device that is amazing, right? That's done. Okay. Now we want to make sure that you have the power and the knowledge to use it. Because if I give you the world's best laser, but don't tell you how to use it, I failed. So that's where we really want to excel here. A few other things to point out, we are going to have a higher power. So this will be a higher power laser compared to the Avant. However, it will have a better safety rating. So the Avant is a class 3B laser. The 528 is a class 3R laser. That means it's safer to use in the office. That means for a clinician, I don't have to be walking around with laser safety goggles. If you see that little this on my wall, this is a little notice saying, hey, I've got lasers being used. I don't have to use those anymore. I don't have to have a laser safety officer, all these kinds of things. So from a clinical perspective, it's a big deal. And it's safer for home. So that's a big deal too. I already talked about the battery. And then this is what we're making. We're making a laser system, a platform that we will continue to build on and iterate. And I'm not going to go in too many tangents here, but this device is going to be, it's going to have more bells and whistles in the future. So I could continue, but I don't want to speak an hour just on that one topic. So another question I definitely wanted to answer, and a lot of people asked it, and rightly so. They say, I pre-ordered, when's the first release? Okay, we're still saying Q4. Okay, so we're still saying Q4. We did want to go through another round of beta testing, so we have another round of betas coming in just to make sure that we got just a few bugs. There wasn't much, but we want this to, again, we want this to be quality product when it drops. So we're still shooting for Q4. I would say most likely a little later Q4. Okay, so that's what we're shooting for now. I'm hopeful. We're doing everything we can. We are definitely pushing this machine as fast as we can. So that's the answer on that. Okay, so I'm going to go to this long list of questions here. All right. How will the laser help in cases of global developmental delay? Um, so that's, definitely a specialty of mine. My fellowship is in childhood neurodevelopmental disorders. So I've been using lasers for developmental delays, autism, any type of spectrum disorder you can think of. Here's what I'll say. If you just use the laser, yes, you'll see results, right? But really what we've seen is it's the combination of co-activation with laser use. So in developmental delays, there's typically areas of lower functioning parts of the brain. There's areas of higher functioning parts of the brain. And so what we want to do is we want to increase metabolic activity, neuronal firing rates in those lower, weaker areas. And then we want to laser over those areas. So it's this concept of co-activation. That's where I've seen the best results. Now, again, will you get results if you simply just laser, right? And I'm speaking as a clinician. If you laser the head, yes, we've seen results like that, and I've had patients that simply, lasered their kiddo with some type of delay, whether it's autism, ADHD, OCD, Tourette, something like this, and they did see results. And there's several reasons why. It could be inflammatory base, it could be a neuroautoimmune component, it could simply just improve the firing rate of the neurons and whatnot. But again, I will say I think you'll get better results if you do that co-activation strategy. We are doing everything we can to be able to fold in those types of programs within our legal bounds. Okay, so that is a conversation that we're engaging with our FDA consultants to make sure that, again, we can deliver as much as we possibly can as long as the FDA, is okay with what we're giving you. Okay, so that conversation is happening right now. Oh, I love this one. Have you ever healed a leaky gut before with photobiomodulation? I highlighted this one because the answer is yes, like a resounding yes, actually. I have a good friend. He's a doctor in Florida, Dr. Steven Zanfini, and he actually did some cool pilot studies with the lasers for us. And he would run gut testing. He would do stool testing before he started working with people. He had a lot of gut disorder, dysbiosis, SIBO, parasites, all these things. And he did this round of where he would just laser all four quadrants, right? And so he would have multiple lasers. He would have the gut just lit up. And I don't remember the parameters. But the cool thing is that not only did symptoms change, but the labs changed. So you would see autoimmune markers going with to normal ranges. You would see SIBO markers change. And again, symptomatology would change too. He would actually have patients reporting parasites coming out of them while they were just doing the laser therapy. So the answer is yes. Absolutely, you can address a leaky gut by using lasers for sure. Um, would this help Parkinson's? Yes, I've seen it clinically, right? So I'm speaking as a clinician. Yes, laser therapy, not only have I seen it help Parkinson's, but there actually are papers written on this. One of my friends actually, she's in Italy. She is a researcher. She also owns another photobiomodulation company. She did some really good research on Parkinson's and photobiomodulation. I went and spoke at La Sorbonne University with her actually a few years ago, and we got to catch up on that. But the answer is yes, it can help with Parkinson's. Parkinson's is a multifactorial disease. Yes, it's a neurodegenerative disorder. Yes, it involves, reduction in dopamine production from the substantia nigra, pars compacta, et cetera. But there's so many other things to consider there. Again, is it neuroautoimmune? Are there mycotoxins? Is there a gut disorder? All these things, right? But the answer is yes, it absolutely can help with Parkinson's. This next one is huge. Can this help improve damage caused by an ischemic stroke? So again, I'm speaking as a clinician. We see ischemic strokes all the time. In fact, we see hypoxic and anoxic type of brain injuries on the regular, right? There was one point where we were booked out like many, many months in advance, and it was largely anoxic type of brain injuries. Um, Now, there's a lot of things to discuss here, and actually, I wrote about it in my book that we're looking to publish. We're trying to figure out who's going to publish it. We're going through that process right now. But when you have an ischemic stroke, that means there's reduced blood flow, lack of blood flow to an area. Well, there's something called a no reflow phenomenon, and there can be secondary damage caused by the damage in how those blood vessels respond. Like they can actually reflexively open and allow too much blood flow to come in. That's called a no reflow phenomenon. So it's not always just about let's push blood in, let's push blood in. This is where photobiomodulation excels big time. It modulates blood flow, right? So everyone is like, oh, you increase blood flow, you increase blood flow. Well, the rhetoric should actually be it modulates blood flow, because what it's going to do is it's going to start to allow blood flow to start to come back into these regions that did not have any, but it's not going to allow for that big rush to come in, right? And when you look at the literature, you're going to see that photobiomodulation is oftentimes referenced as the great regulator or the great modulator, right? So you'll see there's some studies that look at calcium influx into the cell. Well, that can be excitotoxic, right? If you get too much calcium in the cell, that can be the initial cascade of inflammation. Well, some studies show that photobiomodulation increases calcium influx into the cell, while some studies show that it reduces calcium influx into the cell. Again, it's modulating. You still have to have calcium in the cell. So what if this cell needed it and that cell didn't? That's where photobiomodulation will regulate. Same thing with NF-kappa B. NF-kappa B is a double-edged sword. You have to have it to create neuroplasticity. Too much of it and you get excitotoxic. Same thing in the research. You'll see photobiomodulation will raise it in some studies, lower it in some studies. Again, it's modulating. That's why I love this thing. Okay. Any long-term side effects from using the laser? Absolutely, there's long-term side effects. You're going to be happier, healthier, and have a better life. So here's the thing. We are designed to be under light. Now, we're not designed to be under these fluorescent lights. We are designed to be under red, infrared light all day long. Like this is what we're designed to be in. Now, obviously, the sun is full spectrum. I get that. However, the majority of the sun's rays are red and infrared. That is what we are designed and programmed to live with. Okay. So long-term side effects. No, I mean, okay, if you take the laser and just stare into it for an hour and you burn your retina, yes. So don't use it like that, right? So as long as it's being used in a way that it's supposed to be used, and you work with a doctor, you listen to us, or you follow the programs or whatever you're doing, it's going to be good. Okay. All right. This was a good one. Okay. We laser our son when he's sleeping. Does that have a more or less positive effect? Okay, so I've told people for various reasons to use a laser while they sleep. The main reason why I'll do this is to enhance or modulate the glymphatic system. So your glymphatic system is the system that activates in your brain, in your central nervous system, when you're asleep. And it's doing many things. It's cleaning up debris, metabolic debris from, all the thought processes and all the activities that your brain was doing during the day. It's modulating the inflammation. It's getting rid of inflammation. It's doing what it's supposed to do there, right? It's taking out the trash, right? If you don't do that, this is when you wake up all groggy. Like you wake up and you're tired and you have to, it takes till 10 a.m. to actually finally get your brain turned on. You're still slamming the caffeine and You're just never really that nice, clear-headed self. There's other things and other ramifications that come from this, but this is a big reason why I like people to use a laser when they're asleep, and specifically in stage 4 and REM is ideal. Um, Side note, tangent. Again, I'm known for tangents, sorry. I was working with someone's son. He was actually another doctor. He had an autistic kid. It was a nonverbal autistic kiddo. And he said, "Hey, can I just use a laser on his head all night?" And I said, "Well, that's a large dose. I'm known to push the limits, but I can't recommend that. Never seen anything that suggests it. I probably can't recommend it clinically." And he said, "Great, I'm going to do it." And so he did. And so he said, "Well, if I were to do this, what would you recommend?" Right. So I gave him some dosing parameters and whatnot. And I said, "Again, I don't recommend it." He said, "Thanks, I'm going to do it anyway." He literally, he called me, I don't know, it was like a week later or something, said, "My kid started talking." I was like, "You've got to be kidding me." So he lasered his kid all night. The kid woke up. He was able to begin to speak. It was amazing. Um, so that was interesting. Why? Well, I think there was a heavy neuro autoimmune component to that case. I think that was a big part of that kiddo's autistic diagnosis. And when he lasered all night, and he had it right over the top of the head, we had it about a foot away to reduce the dose. He just modulated that glymphatic system, reduced the neuroinflammation, allowed for networks to really solidify. Right, there's a lot of neurochemicals that are solidifying, whether it be memory or different, they're consolidating different pathways and what. There's a lot of things that's going on during sleep. But it was very, very positive for this kiddo. So I've had people laser their gut while they sleep. Actually, my friend Kyle, right? So Kyle Daigle, when he had a pretty severe mold and mycotoxin exposure, I told him, "Put the laser on your liver all night." And so he literally would sleep with the laser over his liver all night. One time he was staying at my house. I think we were recording something here in Austin. And my youngest kiddo, he was staying in my oldest kid's room. My youngest kid woke up during the middle of the night, went in there, climbed in bed with him, moved the laser out of the way, and climbed to bed with Kyle. It was funny. Anyway, so yes, there's multiple reasons to laser during the night. It's half of your lifetime is spent while sleeping. We're still trying to figure out when and why, are the best scenarios to be able to laser while we sleep, but it's definitely very positive when we've done it. Okay. Um, does it help with seizures? And then they say specifically occipital lobe. This is a conversation that I have clinically almost every day. We see a ton of seizure disorders. And it's honestly the only reason why we see so many seizure disorders is because of the results that we get. We never, went out trying to, work with seizure disorders. It was just always a byproduct of the types of, patients that we see. And what we notice is over time, people would report back, "Hey, seizures are better, no more seizures," like all this kind of stuff. So the answer is yes. Now, here's some caveats that we've found along the way. We want to start with longer wavelengths. And we want to start with longer wavelengths because the longer the wavelength, the lower the energy per photon. If you go and blast someone with a seizure disorder with these high energy photons, okay, you're going to have a higher incident of increasing seizure activity, whether it be frequency, intensity, duration, something like this. You have a higher likelihood of increasing that seizure activity. It's still transient, right? So it's not like we increase that seizure disorder forever and ever. It's still a transient rise, and I still see them improve. But if we start with that longer wavelength and slowly work them into the shorter wavelengths, we have a very high success rate, and we lower our risk of increasing any kind of seizure activity at that point in time. So, which, by the way, is another big differentiator in the Avant laser and the 528 laser. And again, I'm only comparing those two because that was a question that was asked. The Avant is 635, 637 something nanometers, which is red, and they have 808 nanometers. We have the 638 nanometers, 808 nanometers, plus the addition of 975 nanometers, which is even longer. This was one reason why I wanted a longer wavelength, because we see so many complex neurological disorders that do have seizures. So I want to get an even longer wavelength to work with this population. There's other reasons to use 975. I believe I talked about that on the previous call in 528. If someone wants that recording, just reach out and we can get it to you. Okay. Okay, so Iris is referring to what setting did he use on his son's head? This was many moons ago. Let's see. I'll be honest, if I told you, I'd be reaching into some deep recesses in my brain and I may not be telling the truth. I don't necessarily know. If I know myself, I probably told him to use 528, 528 hertz, but if he was sleeping, I may not have used that high of a frequency. I may have used more of like a theta or a delta wave. I would have to go back and look at our conversations and see what, what was used. Sorry. Let's see. What's a good protocol first thing in the morning? I love this. Okay, so here's what I do. Wake up in the morning. I will do my coffee. I have some peptides I do. But I do the coffee for sure because that starts to get my brain going. That starts to, get my thought process, starts to wake up my brain, all these things, right? So I'm starting to get my frontal lobes going. I will also, me personally, I'm going to do optokinetics. And so I actually pull up, it's an app, it's called Focus Builder. I'll do some optokinetic reflexes with my eyes. I'll do to the left, to the right, up and down. And then I'm going to do some gaze fixation VOR. So I'm going to I'll hold my thumb out, my eyes will stare on my thumb, and I'll just simply go side to side with my head at about this rate. I'll go side to side and I'll go up and down. Okay, so I'm activating parts of my frontal lobe, my prefrontal cortex, my vestibular system. I'll do that. Why? Co-activation, okay? I'll then use the laser. I'll use it over my carotid arteries. I'll use it over my vertebral arteries, and then I'll use it over my frontal and my prefrontal cortex. I will also use a beta wave. So I'll go into brainwave settings and use beta, and I will use the infrared, the 975 nanometer, and I will use it transretinally. So I will use it through my eye. I'm not advising you do it. Tell me what I do. I do that because of the pilot studies that we've done in my office where transretinal photobiomodulation changes brain waves within seconds. So with that information, and I feel it, like I'll do it for literally like 20 to 30 seconds. It's not like I'm sitting there for an hour, right? I'll feel it, like I'll feel my brain wake up. So what we're doing with that, so I reached out to an ophthalmologist I know. We're forming a study where we're going to find safe doses. We're going to measure the retina and the optic nerve. We're going to look at it. We're going to scan it. We're going to do this transretinal laser application. We're going to note the changes in the brain, but then we're also going to note, did we do any damage to the retina? Did we do any damage to the optic nerve? That way we can then turn around and say, hey, here's the safe parameters. On that same topic, I was diagnosed with glaucoma way back in the day. I don't have it anymore. It's not diagnosable. I can show you my scans, all the things. Was it because of how I laser around the eyes? I don't know, but I think that was a big factor. Okay, so that's my morning routine, right? I'll also laser my thyroid, which this is a little segue. That was a question. Can you laser the thyroid? If you can't, then I'm screwed because I laser mine every single day. I've got pretty, well, it's not severe anymore, but my thyroid was a big reason that I actually sold everything and moved to Costa Rica. I mean, my TSH was a 25 back in the day. So I had primary hypothyroid. And I also had Hashimoto's, so an autoimmune thyroid condition. Now, back then, the studies were just coming out. Now there's studies that show if you laser the thyroid, it improves thyroid medication, right? So it improves how well the thyroid medication is working, and you have to lower your dose. I will tell you that I've had to lower my dose. Hey, Sherry, good to see you. I actually started with a 200 microgram Tyrosint dose. So I use Tyrosint, so liquid thyroid medication. Once I've been lasering my thyroid consistently, I actually had to drop it down. I think I had to go down to 175, and now I'm down to 137. If I take higher, I'm like anxious, jittery, heart palpitations, like it's too high of a dose. So for me, is doing some really good things, right? So that was a question later on down the list. Can you laser the thyroid? The answer is yes, and you should. Okay. From Andy here. Can laser therapy help with hemiparesis? Yes, you can come into our office almost any day of the week and you'll see some flavor of hemiparesis, whether from stroke, brain injury, infection, something. And yes, we use laser therapy for that very effectively. From a coactivation standpoint, you want to activate the paretic areas, right? So if it's a hand, you want to activate the hand, whether you're using vibration, deep pressure, some type of movement strategy, something like that. And then you want to laser over the same side cerebellum. So if it's my right hand, you want to laser over the right cerebellum. You want to laser over the opposite side parietal lobe, the opposite side motor strip. Um, that's, if I don't know exactly where the lesion is and all that, that's a general outline. So the answer is yes. It's a resounding yes, actually. Okay. Going down the list. Any plans for blue or green laser? Yes, we already have a green and violet that will come out very quickly. We do have betas on those. So the first focus was red infrared release, right? So that's first focus. Quickly thereafter, we will have the violet and green release. And again, that'll just be the module, right? So you don't have to buy all this other stuff. You can just get the module, plug and play. There you go. You got a whole new laser, right? For fraction of the cost, which is fantastic. What I'll say is green is blowing me away. Um, Green is something that I've wanted for many years. Um, it is blowing me away. Okay, so I've been able to use our beta green, and my son, he has eczema. I think I talked about it in a podcast, but basically we went to I think it was Barcelona. He got a big exposure to nickel, and that he developed, a pretty good flare of eczema. We did detox. We were doing all the things we know how to. Got better, yes, but it was still lingering. I brought the green laser home. I lasered over his eczema, and he woke up the next day. It was literally like 40% better. I was blown away. I didn't expect it. Um, Green really structures. It structures our exclusion zone water, and it has an influence on us at the DNA level, right? So green's huge. It's a carrier frequency. It really, really, truly does have a completely different mechanism of action. And honestly, a lot of that is still yet to be understood. So I'm super pumped to see that. Blue's interesting, guys. It's like I get excited about blue and then I get depressed about blue and then I get excited about blue. Of course, if you don't know about the information talking about how blue light influences your melanopsin and all these cells, these cells in your eyes and your brain. The blue light can have a negative impact on your circadian rhythm, your circadian biology. So you don't want to like inundate yourself with blue. But I was actually just reading a paper yesterday or day before, talking about how blue actually has this really cool interface on how it reduces adipocytes, so it actually reduces fat stores, and then actually has this regulatory component where it influences the hypothalamus. And so it actually, has this whole nother mechanism that, again, still don't fully understand it. But we currently don't have blue like in the product lineup as far as like, hey, this is for sure our next thing. But what I'll tell you is that we could very quickly iterate and say, hey, let's put blue out there. And if I keep seeing research like what I was just referencing, we will. I mean, there's no reason why we wouldn't. So, okay. Can laser therapy help? This is from Sarah Jane. So can laser therapy help with lesions due to MS? Yes, there's actually studies on that. I've had multiple patients with MS. Obviously, the earlier, the better with this. And what I'll tell you is you want to use it over the peripheral nerves. You want to use it over the spinal cord. You want to use it over the brain. In fact, I knew one of the longest living people with ALS. I know it's different. So ALS is Lou Gehrig's disease, similar etiologies. And he was a cardiologist. I said, what's your secret? How have you gotten around? And it wasn't just that he was alive, it was that he was functional. And he literally told me, he said, I laser my entire body every single day. And I said, dude, why don't you like get a red light bed or something? He said, no, there is a difference. This was him. He said, no, there is a difference in using the laser versus the LEDs. And I said, I know it's a Kia versus a Ferrari. I get it. But I was, it was cool that he was able to point that out. And that was just from his real life experience. So can it help? Yes. Does it? Yes. There's literature on it. Absolutely. Okay. What additional training or education is required to start working in this field? This field of photobiomodulation does not technically have a clinical designation, right? So photobiomodulation is more of a modality added to another field like functional neurology or physical therapy, oncology, right? So it's more of a modality. I was asked to help produce a PhD program in photobiomodulation many years ago. I said no, I didn't have the time. I would love to be able to produce a clinical degree program for photobiomodulation. I've loosely had some discussions with some people out of Cornell University. I think if I wanted to do that, I think I could do it there. So for now, I don't know what to tell you. You can continue to listen to my podcast. No, I'm kidding. If you're looking for like training in photobiomodulation, I absolutely want to continue training. I've had to really kind of step back from education over the past year, largely to, focus on developing the laser and focus on a few other projects. But I do want to really hit it hard again. So education is important to me. I know that in NeuroSolution, we've done conferences, we have some recordings, etc. So you can reach out to Jill at NeuroSolution, so info@neuro-solution.com. And I can try and get you, what you're looking for. So I'm not sure exactly what you're looking for, so we can continue that conversation. Okay, Iris, what causes tics and how can I calm them down? So you're talking to a guy that used to have Tourette's, as did one of my sons. And I don't have tics anymore. I had a vocal tic. I had a physical like neck, shoulder tic as well. So this is a story about the direct, indirect, and hyperdirect pathway. Largely the hyperdirect pathway is typically where I like to focus. The hyperdirect pathway comes out of the right prefrontal cortex. Largely, it comes down and it really starts to integrate and increase the indirect pathway. It basically gives you the ability to inhibit. This is largely a neurological discussion, which is fantastic. From a laser perspective, you can use the laser over the right prefrontal area. I like to use it through the temple. I'll use it through the temple because with that type of angle, you're going to actually have a good influence over the midbrain. It's a great way to laser the midbrain through the temple. So what causes it and how can you calm it down? That's a longer discussion and largely more neurological. Can you use lasers and should you? Yes, absolutely. Maybe something for next time, or maybe something in like a neuro solution. I don't know. We'll figure it out. Okay. Will there be guidance for Lyme and dystonia? I know it depends on each patient. Um, as much as we can possibly give you, yes. Okay. I think Lyme would be easier, um, simply because I can help you. I can give you protocols for the immune system, for autoimmune, like this kind of stuff, without saying, hey, this is what treats Lyme. So that's kind of the way that we're navigating that. In fact, the immune protocol that we have in NeuroSolution that we've been using for many years, I actually developed that for a cancer patient out of Belgium, I think. And it has performed extremely well. And that's the immune protocol that we have in our NeuroSolution manual. Again, I'm not saying it's a cancer treatment or anything like that. I'm just saying like that's what we use it for. And it's called the immune protocol. We've used that for Lyme. We've used it for various autoimmunities. We've used it for COVID, long haul COVID, this kind of stuff. It's done well. So I think that one would be easier. Dystonia is interesting, man. Like I've worked with all different types of dystonias, and there's I've yet to see a case of dystonia that was exactly like another case that I saw. I'll say it that way. So could I put a dystonia treatment, protocol in the laser? Um, Perhaps. I think it would be more about like a general brain health, movement disorder health, like something like that. And then just make sure that you're working with, a good functional neurologist as well. Okay. Okay. Is there a limit on how much you can laser the brain, whether that's with infrared or red, for example, motor strips, etc.? Okay. So yes, there's a limit, right? So this is a discussion about the biphasic dose response curve, aka hormesis. So I was just talking with someone, where were they? They were in Slovenia. Um, and it was a patient and they were wanting to have advice on how to use the K laser because they already have the laser and they wanted our help because we laser the brain, etc. And what I was trying to explain to them is that the type of laser beam that's being produced by that laser, it's very collimated, right? And so it's very focused. So we're going to have to reduce the power quite a bit, like well beyond, like well below what we're using in our laser. And it's because of the type of laser beam that it is, right? So just like you can take a magnifying glass, you can go outside, you can burn ants, right? You can focus the sun's energy and burn the ant. You can do that the opposite, right? You can spread those photons out and you can actually increase the dose, right? Without causing harm. So it, in our laser, we've designed a type of laser beam that we can have a higher power, but a safer quality laser. So we can laser over the brain for longer. We can laser over the body for longer and not cause harm. So I say all that to say this. That question hinges on what laser you're using, right? So we'll give you parameters within hours of, 2 minutes, 3 minutes, 5 minutes, etc. Right? So we'll give you those parameters. Um, but yes, there is a hormetic curve that we need to adhere to. I can't give you dosages for other products that I haven't really used. Um, let's see. Okay, so tell you what, so we got roughly 10 minutes or so left. Um, does anyone have a question that they want to open up and ask?
Good question.
Yes.
What is the runtime on the battery?
Oh my goodness, that was a question from last time. Okay.
Because you're talking about running it all night, and you go, well, what is the runtime?
Oh, he had it plugged into the wall
Okay.
when it went all night. Yeah, it was plugged into the wall. Runtime, okay. I want to say the runtime is close to 2 hours if you just turn it on and leave it. Okay. And that will depend on, what frequency are you pulsing, the temperature of the room, etc. Roughly probably around 2 hours. Um, were you the one that asked the question on the battery last time?
Maybe. So the fan is built into the battery. What does it
Yes.
cost to replace the battery if it has to be replaced?
What's the cost of the battery?
If you have to replace it, yeah. What if the fan goes?
Probably about $3 million. I'm joking. I'm joking. I'll be honest, I don't know the hard cost on it. We're not going to be making money on, selling you parts if something fails, right? So obviously there's going to be a warranty.
Right.
If you're under warranty, then it's no cost. If it's outside of that warranty, then it'll be basically whatever the cost is of that product, of that part.
Well, the reason I asked that, it sounds like that's the only moving part on it, so it's most likely to fail the
Correct.
fan. Yeah.
Correct. Yes,
Mhm.
absolutely.
So one other question I have lung problems. Will the laser help me with congestion in my lungs? Like I have trouble clearing out mucus. I typically during the course of the day, a couple of times I get large masses of mucus that occlude my, bronchioles, and I have trouble breathing until I cough them up. Will I get any benefit from lasering my lungs?
I highly expect you to. Yes, I would be.
Really?
I would be surprised if you started using this and you didn't see a benefit. So I do
Yeah,
expect you to get better. Yes, I do. I
that
expect
would
it
be
like
major for me. Major.
yeah.
That is
Well,
that's yeah,
I'm really curious, to see how this helps you. So I
yeah,
definitely want to follow up and see how you're doing with that.
for sure. Yeah. I love this
Hi,
technology.
Yeah, me too, man.
I have a
Okay.
question. That's okay.
Yep.
So,
Go for it.
hi, this is Michelle from New Zealand. Good
Hey, how's
morning.
it going?
Good. So I'm looking at purchasing this for a clinical setting for our clinic. And we don't use any lasers at the moment, but we're looking at different ones and we're not quite sure where to go. So, we have some of our clients we see weekly, some of them we do intensives with. If we're seeing clients weekly, are we, say, for example, if you have a client with tics and they're doing their program, their movement program with us, and then, they come to us for their one session a week and we're lasering them, is this effective just once a week?
It is. But if the goal is to establish neuroplasticity, then we need to consider frequency, intensity, and duration as stimuli. So
Yeah.
I would argue, yes, it would be beneficial, and especially if whether it be finances or whatever, right? They're only able to come in once a week, then we absolutely want to add photobiomodulation because it's only going to enhance what you're doing and it's going to increase your brain-derived growth factors. It's going to increase all the things that you need to help create neuroplasticity faster. So you absolutely should be using it, especially in those scenarios.
Yeah, thank you.
Mhm. Any other questions from anyone? What's up, my man?
Okay, so can you use this to shift yourself into more vagal tone? Like I think I'm running parasympathetically dominant, so I'd like to have more vagal tone going on.
Yeah. So the answer is yes. And the cool thing is, so when we were at the biohacker conference, I had someone, she came up and we did our, carotid artery lasering. We did a vertebral artery, and I did GV20, which is an acupuncture point over the top of the head. And she came back to me maybe a few hours later and she goes, I don't know what you did to me, but my aura ring registered that I was taking a nap whenever you were lasering me. And I was like, whatever. And she like pulls it out and she shows me. She's like, look, and it did it. It showed her taking a nap during the time that I lasered her. And I was like, did you take a nap? She's like, no, I didn't take a nap. So yes, and the discussion around that is, look, it's regulatory. So the majority of people need more vagal tone. It's just because of the type of society we live in and the stress that we're under, et cetera. And the vagus nerve comprises about 75% of your parasympathetic nervous system. So if you use a laser and it's going to regulate your nervous system, it's likely going to increase vagal tone, right? Um, have I had patients where we needed more sympathetic tone? Yes, I have. And in those patients, the laser increases sympathetic tone. Again, it's modulatory. It's fantastic. Good question.
There's a couple more questions for everyone. I've just been putting these questions in the Google Doc for Brandon. So there's 3 more questions that were put in the chat.
Oh. Can you put your cursor over the ones I didn't get to? Oh, it's because I was on the wrong page. Okay. So what's the difference between the regular Avant laser and the new one you've just come out with? Is there more effective than the other specific areas? Okay. So Andy, I want you to watch the recording because I opened up talking about comparing the 528 laser to the Avant. And that was just because I was asked to. That was a recurring question that we were getting. I'll just reiterate, I still use the Avant. I think it's a good product. A big reason that we started 528 Innovations is because we saw how we could advance laser technology and create something better. I mean, that's essentially a big reason why we made it. So I would say we'll send the recording out to you and you can listen more to that. If you still have questions about the comparison of Avant to 528, please follow up, let me know so I can answer those questions for you. Okay, people are reluctant to try new therapies. Any suggestions on approaching this subject with family and friends? Yes, here's how. There's thousands of research articles that have been done over photobiomodulation. Literally thousands, been researched since the 1960s. Hundreds of human clinical trials, okay? I'll say it this way too. If there were a drug or a medication that did everything that photobiomodulation does and was as safe as photobiomodulation is, everyone and their dog would be on it. I'm telling you, people would be standing from the rooftop screaming, everyone needs to be on this product. The safety profile is almost not comparable, right? Like the how safe photobiomodulation is amazing, especially coupled with all of the potential upside, with how many things that it has the potential to do. So those are typically the ways that I talk about it. I'm never going to talk anyone into doing a therapy or a treatment of any type. I just want to point them in the direction of the research has been done. It is safe. It is effective. I can't find a reason why not to use it, right? That's typically the conversation I have. Okay. Prefrontal cortex setting. This Iris is referring to a neurosolution setting that I made for the prefrontal cortex on temple for tics duration. Okay. No, for tics, I want you to use, if you go into brain waves and you find your sensory motor rhythm, sensory motor rhythm is AKA a low beta brainwave. I want you to use low beta. I don't know the clinical picture, so I would start with infrared. And I would use it for, again, I don't know the case. I would start with 2 minutes over the prefrontal. I typically end up, going for anywhere from 3 to 5 minutes over that area. And I'm not just going to go through the temple. I will go through the temple, but I'm going to sweep over the entirety of that prefrontal cortex while I'm doing that. I will want to co-activate, right? So we can do go, no go activities. We can use the Mindy, which is a really cool device. You can increase blood flow into the prefrontal cortex by using the Mindy. We can do that VOR, gaze fixation with VOR activities. There's various ways to co-activate the prefrontal cortex. But you want to use sensory motor rhythm. That's just something that I've seen that has worked most effectively. Okay, psoriasis, this laser, or green like you discussed for eczema? Both. The answer is both, because red and infrared have been documented to help psoriasis. Green, I can't say that I've used green laser on psoriasis. I expect it to work very well. We'll see. I think we have a potential, I guess, pilot study, if you will, or case study that I believe we're planning to use the laser on for psoriasis in 528. So to be determined. Cool. Did I miss anything else, Vanessa, or is that it?
Oh, there's one more from Shannon. How about for brainstem stroke?
All right, brainstem stroke. Yes, you should use it. Now, obviously, there's two different types of stroke, hemorrhagic and ischemic. Obviously, you need to deal with the acute effects of the stroke. So obviously, you go to the hospital, do all the things. This does not take the place of any kind of medical care. But yes, so when it comes to the brainstem, we just have to understand where to use a laser in order to access it. We have this area behind the ear. In neurosurgery, it's called the retrosig. So it's this area right behind the ear. When you put the laser like on the body, like on your head like this, and you have that angle, that's a great angle in window in to what's called the rhombencephalon. The rhombencephalon is comprised of the cerebellum, the pons, and the medulla. So here, I'm behind my right ear. I'm having more of an influence on the right cerebellum, the right side of the pons, and the right medulla. How do you increase your specificity? Well, you do it with co-activation. So if I want to influence more of the cerebellum, I do a cerebellar activity. I'll do some arm circles, vibration, something like this. If I want to have more of an influence on the pons, I might stim the tongue or do some kind of trigeminal nerve stimulus or something like that. If I want more medulla, maybe I'll do some vagus nerve activation or some kind of medullary based activity, right? To increase the metabolic rate of those nuclei. Then I'm going to have a more specific targeted response. Another window in is through the mouth. So through an open mouth with an angle up, that's going to be hitting the front of the brainstem, largely the pons and the medulla. I have gone through the posterior aspect, right along the EOP, like right at the base of the skull, pointed up. That's going to be more midline cerebellum. There is, studies that look at lasering up the nose. In my clinical history, this has a greater influence over Klaboch's plexus, which is a very rich capillary bed that runs up into the prefrontal cortex. So I think lasering up the nose has more of an effect on the prefrontal cortex. I've seen better midbrain influence by going through the temples. So that's just my clinical experience. And through the eye, when you look at the optic tracts, it goes right through the top of the midbrain. Again, I can't recommend anyone laser through the eye. I'm just telling you what I've done clinically. So those are the windows into the brainstem. Again, co-activation is a huge, huge, huge friend of yours when you're lasering the brainstem. Okay. Awesome. Well, we're about out of time. If anyone has any last minute questions, let me know. Otherwise, we will get this recording sent out to everyone. I appreciate everyone being on again. How do we order? Good question. So if you're a NeuroSolution patient, NeuroSolution provider or whatever, you can reach out to Jill. That's info@neuro-solution.com. 528 Innovations, we have Stephanie. She's on the call right now. I know many of you are working with her, so I want you to order through her. So you can either reach out through Stephanie, through 528. If you're with us in NeuroSolution, you can reach out through Jill. There's websites, there's emails. If you need anything, just reach out to us and we'll help you out. Okay. Cool. Well, I really appreciate everyone taking time out and joining me today. Like I said, we'll get this recording out to everyone, and I look forward to next time. Thank you so much, guys.